This is cause of rim nephrogram, acute complete arterial occurrence. 15. Again, more pregnancy ultrasound. Patients with low P1 are more likely to become resistant to single drug therapy than with methotrexate because increase in AV shunting. Pain with low P1 are more likely. This is P1 is the resistance index. When it is low, then they become in single. Then there is AV shunting, and AV shunting causes patient will get resistant to drug therapy, single drug therapy. 2016, series a large right kidney with large Saigon calculus and had nephros most likely diagnosed problem. 17 non-symptomatic germ cell tumor is diagnosed with answers right side tumor spread initially to aortic node. Non-symptomatic germ cell tumor is diagnosed with answers right side tumors spread initially to aortic nodes. 18 involvement of it indicates the poorest prognosis in recurrent endometrial cancer spleen. Poorest prognosis in recurrent endometrial cancers involvement of spleen. 19 which most favors diagnosis of adult prostate sarcoma rather than adenocarcinoma, soil and cystic components. As for sarcoma, as for soil and cystic components. 20 paratesticular space most common benign tumor is endocarcinoid tumor. 21 3-centimeter lesion on the left kidney, MRI shows isolation test in phase sequence and low signal on the upper phase sequence, who are diagnosed with AML. 22 in prostate cancer with changes in MR negative reading spectroscopy, elevated choline and citrate ratio. Prostate cancer, elevated choline and citrate ratio. 23 which would contraindicate buscopan injection, myasthenia gravis. 24 in dynamic renal imaging, total divided renal function are evaluated in addition to rates of transit through parenchyma and output tract. In dynamic renal imaging, total divided renal function are evaluated in addition to rates of transit through the parenchyma and output tract. 25 diagnosis of polyarthritis nodosa, which is true, produces moth-eaten nephrogram of the thrombosis of the microaneurysm. Polyarthritis nodosa produces moth-eaten nephrogram of the thrombosis of the microaneurysm. 26 new onset hypertension, MRI shows narrowing at the distal right main renal artery, most likely diagnosed by muscular dysplasia. Primary muscular dysplasia causes 35% renal artery stenosis. New onset hypertension, so they are narrowing at the distal right main renal artery, so most likely diagnosed by muscular dysplasia with 35% renal artery stenosis. 27 3-centimeter cystic lesion on CT, thickened septate with nodular is of classification, which positive classification described above, then stage 3. Stage 4 will have irregular walls and septation. 28 T2 disease in renal cell carcinoma, tumor size greater than 2.5 cm. T2 in renal cell carcinoma, tumor size greater than 2.5 cm. 29 regarding lymphoma of the kidney, CT may demonstrate sheet-like diffuse infiltration of peritoneal tissue. 30 regarding metastatic site of disease on the kidney are usually hypovascular on CT. 31 which most favors renal cell carcinoma than renal cell carcinoma, renal vein invasion seen in renal cell carcinoma. 32 concerning squamous cell carcinoma of the kidney, renal calculi present in most patients. Squamous cell carcinoma patients. 33 which is the cause of cortical rather than medullary nephrocalcinosis, acute cortical necrosis. Concerning squamous cell carcinoma of the kidney, renal calculi present in most patients. 34 recurrent high nephrosis of pregnancy occurs in 90% of pregnant women by third trimester, disappears postpartum. Nephrosis in pregnancy occurs in 90% of pregnant women by third trimester and disappears in postpartum. 35 which is the neoplasm affecting the breast that is least likely to contain bone cartilage or vascular tissue lymphoma. 36 regarding endometrial carcinoma and MR, usually low signal, then bright enhancing normal parametric tissue over contrast. Endometrial carcinoma is also low signal, but then bright enhancing after contrast. 37 which ovarian masses appear more cystic than solid endometriosis. 38 which is the least likely to result a malignant lesion in the breast, thin halo. Thin halo surrounding lesion is not malignancy of breast. 39 which is the best at distinguishing fibroma from carcinoma, homogeneous echopattern. 40 MRI shows two separate normal size uteri and cervixes with septum extending into the upper vagina. The two uteri are widely separated with preservation of the endometrial environmental width. What abnormality? Uterine uterus gyradelphi. 41 as it is a small vertical outputting in the isthmic portion of the right fallopian tube with distal tube occlusion, diagnosis salpingitis isthmica nodosa. The vertical outputting in the isthmic portion of the fallopian tube. 42 recurrent rectal peritoneal fibrosis in the primary form response to steroids. 43, which is most likely to cause bilateral small rather than large kidneys, polycystic kidney disease. 44, recurrent clear cell tumor of the ovary frequently occurs as a unilocular cyst with neural nodule. Clear cell tumor of the ovary occurs as a unilocular cyst with neural nodule. 45, recurrent mucinous ovarian tumors, rupture may lead to pseudomaxilloma peritonitis. 46, recurrent ovarian fibromas, low on T1 and T2, less or equal to metrium. Ovarian fibromas, low on T1 and T2 fibers, low on T1 and T2. 47, echogenic glandular ultrasound, pre-contrast CT has increased attenuation, 60 HU, post-contrast lower in attenuation related to the stronger parenchyma, 61 HU diagnosed with hemorrhagic renal cyst, 60 and 61 HU shows hemorrhage, blood and hemorrhage. 48, diabetic patient with UTI, urograph shows small rounded curvilinear lucencies outlining the bladder wall, diagnosed emphysematous cystitis. 49, regarding MRI posterior seminal vesicles are low signal but invasive tumor. 50, regarding posterior MR, the volume of the posterior gland greater than 60 cc precludes brachytherapy. Next paper, the Barrett, genitourinary tract, adrenal and breast. Now, question number 1, 4 mm area on mammography, multiple long thin spicules come centrally with resolution linear structure paralleling the spicule. MRI shows stellate lesion with strike enhancement up to the administrative contrast medium. Diagnosis, pyloric tumor. Number 2, intravenous. Now here again, thin spicules come centrally without linear structure parallel to the spicules. So this is pyloric tumor. Number 2, intravenous contrast medium for an AIVU. The patient is rapidly unwell with hypertension, bradycardia, and shortness of breath. What treatment should not be used? Adrenaline 1:1000, 0.3 ml per second. Intravenously, it should be intramuscular, not intravenous. 3, testicular lump, gynecomastia, or sounds of irregular hypocritic nodule, most likely diagnosed Leydig cell tumor. Number 4, MRA shows 50% stenosis in the right main renal artery, 1 cm from ostium, most likely diagnosed arteriosclerosis. Most common cause of renal artery stenosis, and second is muscular dysplasia. So, 50% stenosis in the right main renal artery, 1 cm from ostium, most likely diagnosed arteriosclerosis. Question number 5, CT-KV is not correct. The common tail sign confirms the uterine calculus rather than a platelet soft tissue sign. This is not correct because to distinguish between uterine calculus and platelet on CT scan, we do soft tissue rim sign. 6, prostate is correct. Antibiotic prophylaxis is mandatory for translational prostate biopsy. Number 7, cervical carcinoma extends beyond the uterus with parametric invasion but does not extend to the pelvic side wall. Fecal staining is stage 2. Cervical carcinoma extends beyond the uterus with parametric invasion but not pelvic side wall, stage 2. 8, which organs do not usually take up MIBG? Ovaries. 9, ultrasound right complex aggregated mass is echogenic and anechoic component. CT is mass of fat density floating in interface between two water density components. MI is equal to 2 lesions. If you will level like this diagnosis, dermatitis. Number 10, embolization treatment of varicocele. Which of the statement is false? Right side is easier to embolize than the left. Number 11, KUB shows coarse granular calcification, while it is pure in the region of the renal pyramids. Ultrasound shows increased echogenicity of the renal pyramid, the some posterior causal shattering, where least likely Alport syndrome. Because Alport syndrome has calcification in the cortex. But here they are saying the coarse granular calcification in the region of the renal pyramids. So least likely is Alport syndrome. Question number 12, transparent ultrasound shows bright central line with markedly echogenic smooth endometrial margin 14 mm. Mild echogenic posterior causal enhancement is seen with a thin hypoglycemic halo of inner endometrial zone, which is correct. See in the secretory phase of the menstrual cycle. Because normal menstrual endometrium size is 7 to 14 mm. And when a woman is 14 mm endometrium measuring, then she is most likely in the secretory phase of the menstrual cycle. Then 13, CD shows renal mass with a central low accumulation scar. The MI shows hyperintense on T1 and hyperintense on T2 with enhancement of intravenous gadolinium. Central car enhances less, likely diagnosed oncocytoma. This is called spoke wheel sign. Central low accumulation scar in the renal mass, and then it Central scar in age is less than the other tissues, so tender oncocytoma. Question 14. PET-CT, which is the least likely to cause a false positive result, ovarian cyst. 15. Breast augmentation, MRI with multiple hyperintense wavy lines within the implant linguine cell. Hyperintense wavy lines in the implant linguine cell. 16. Multiple previous biological carcinoma of the skin pelvic ultrasound shows left ovarian mass. MRI shows low signal on T1 and T2 most likely negative ovarian fibroma. Low on T1 and T2 are fibers, so for fibroma. 17. Female is overweight. Here should the blood sugar is raised on pinpricking testing. Ovarian disorder is suspected. Which features would not be in keeping with this diagnosis? Asymmetric ovarian size, because in polycystic ovarian syndrome, the ovarian sizes are symmetrical, not asymmetrical. 18. MRI protocol for assessment of endometriosis, which is incorrect. T1 various sequences post-ganglium and material employed. For endometriosis, what we do T1 various sequences post-ganglium administration. 19. Ultrasound to thicken bladder wall with echogenic foci within it. CD shows areas of gas within the bladder wall, which is not consistent with the shared condition, tuberculosis. Because tuberculosis will show calcification and shrunken bladder. 20. A 4 cm renal cell carcinoma is suspected. Tumor thrombus in the renal vein extending to the inferior cava, but no local lymphadenopathy and no distant metastasis. Robson's stage of the tumor is stage 3A. Because involved renal vein inferior cava is stage 3A. 1 is confined to kidney, 2 is to perinephric pad, 3A is involved renal inferior cava in IVC, and 3B shows local lymph node involvement. In 21, KUB shows calculus involving the lower bone and intraocular calculus. Like this composition of the stone is magnesium and ammonium sulfate. Trigon calculus is magnesium and ammonium sulfate. 22. Regarding posterior sarcoma in adult patient, which is correct. Situated Henman cystic chain is typical. 23. Which is the current method of choice for surveillance of the rectal peritoneum? CT. 24. Ultrasound of bilateral multiple non-communicating well-defined cystic lesion in the peripelvic region, renal parenchyma, and in the perirenal spaces. CT shows homogeneous MI low T1 and high on T2 without enhancement. Needle biopsy equal to area of connective tissue with an epithelial lining. Accurate diagnosis renal lymphadenectasia. Because